Hi, I'm Phil. I'm a psychotherapeutic counsellor and a trauma therapist. Today I'm going to talk about how people with different personality types or people who've had different life experiences might feel and respond negatively to the therapeutic relationship that forms between a therapist and client, and how their negative reactions to this relationship might hamper or sabotage the work completely. So, this is a complex subject because all personality types have some overlaps with others. And they have to do because there are only so many feelings that we can experience and so many behaviors that we can act out. We just all tend to do them at different extremes. But this aside, two things that do have a big impact on how we respond to others in and out of therapy are the psychological processes that we know as projection and transference. And I'll try and simplify these for you in this video, and I'll also give you some examples of how these processes might influence us to react or behave around our therapist. So we can think of projection as being a defense mechanism. So it enables us to use the memory of our historical experiences to warn us of what might happen in the present if we encounter situations that are similar to those that we encountered in the past. So it's about memory recall. So a very simple example of this would be that if you were abandoned as a child, your brain might form the very logical assumption at the time that getting close to people hurts us because they leave us. Of course, we're going to believe that's just happened. And this belief, which is based on an actual experience, becomes subconscious and remains dormant within us until something comes along to remind us of it or wake it up. And in this case, it would be intimacy or becoming too emotionally close to someone. So, what does our subconscious do when we find ourselves getting too close to someone? Well, it projects the belief that this person is going to hurt me like I was hurt before. And we respond to that belief as though it is a fact, and we respond defensively. And this is where transference comes in, because when we believe the projection, we're transferring the feelings that we had towards our abandoning parent from childhood onto our new partner or our therapist or our friend, and we're reacting to them in the transference as though they were that actual parent. And if you've not gained awareness that this is what your process does, then you're not going to be able to challenge the transference, which means that you're likely going to react to this person and others who get close to you as if they're the threat that your parents were. So we're all going to get caught up in transference because we've all encountered people in our past that have made an emotional or psychological mark on us. And depending on how traumatized or how many negative experiences we've had, the more likely we are to project and get caught up in negative transference. And this is because anyone who resembles or acts like the people who frightened or hurt us in the past might trigger your brain to project that they could be a risk to you in the present. Just like people who remind you of the people who were kind to you in the past might trigger positive transference and you might feel warm around them. So if you think about this, you can maybe understand how clients are likely to start projecting the historical figures from their past onto the therapist as the therapeutic relationship forms, which means at some point they might start believing that the therapist is capable of doing to them what was done to them in the past. So this might start on day one of therapy, or we might even start projecting how the therapist is going to treat us before we even meet them, before we even get there, which means we're already caught up in some sort of transference that's going to have us going into that first session locked and loaded and ready to sort of defend ourselves from all of the bad things the therapist might do to us. So if we survive childhood by appeasing our parents and suppressing our needs because expressing them brought about negative responses from our caregivers, then the transference might make it very hard for us to speak about our stuff to the therapist. And it might make some people feel incredibly small and shy when they're sat in that room. Something similar might apply if we used to go into a sort of a freeze response and hide ourselves away as children to stay safe. Because someone who learnt to hide to survive is going to feel incredibly vulnerable and visible when they're sat in front of the therapist, which is probably going to get their freeze defense activated. And that's going to make it hard for them to speak about, to project themselves, because they aren't going to want to be seen or heard. And if we were brought up around a lot of deceit and manipulation, then it's likely that those early experiences, they're going to make us feel skeptical of the therapist's intentions. And this is probably going to make us resistant to taking the therapist's advice on anything, and until the relationship develops into something that we can trust. And if we're someone who's had sexual abuse in our past, then we might project that the therapist is going to abuse us, which means that we're also going to be untrusting of why the therapist is treating us so nice, why they're being so interested in us. We might perceive that as being a seduction. even if that's what we went in there for. We went there to be listened to be heard. Once the transference gets activated, that will turn into something else. So in effect, the transference has us on the lookout for when the therapist switches from kind therapist to abuser. And this is why therapists should refrain from physical contact like hugging with victims of sexual abuse until the relationship has been very firmly established, because it doesn't matter how well we think we know our client's process. Any physical contact might flip them into transference, and which means that'll flip you into being the abusing parent. So people who are sexualized as children or brought up in highly eroticized environments, they might not be able to accept that they're liked or valuable if the therapist isn't sexually attracted to them. So this might invite the client to feel the need to be flirty or wear inappropriate clothing to their sessions. And once again, physical contact is something the therapist ought to avoid with people with this process, until the relationship is very firmly established and both in the room know what's going on. And people who were controlled or had no power as children can sometimes react to their therapist with the resistance and rage that they were too scared to do around their parent. And if they express their anger passively, they're going to be feeling the need to resist the therapist's attempts of help. They might also sabotage the work by being stubborn, obstinate, offering a lot of yeah, but answers, and saying they're going to do things and not following through on those promises. They might also feel the need to turn up late for their sessions or not bring payment because they feel resentful that they should be paying for the service. Anything really that baits the therapist to become angry at them. And if the therapist falls for this and does get angry, then the client has frustrated the therapist like they wanted to frustrate their parent. And they might get a sense of pleasure from the therapist's reaction here. So if we were abandoned or rejected as children and we had very little consistency and very few healthy role models, then we might initially project good parent onto the therapist, because a therapeutic relationship that is consistent and caring might be something that we've been yearning for all our lives. So we're probably going to want to fill our boots with that. But because we have trauma that relates to abandonment, as the relationship deepens, the scarier all that good stuff is going to start to feel. So for some people, at some point, the perception of the therapist as being all good might switch to them being all bad as they become the abandoning parent in the transference. And a whole host of behaviors might activate at that point to help the client pull away or punish the therapist in ways that they were punished when they were little. And depending on who you are will decide on which behaviors you use in response to this situation. So people who use splitting as a defense, which would be when our brain sees people as good or bad with no room for compromise in the middle, could feel extreme rage towards the therapist when splitting occurs, or they might just feel that they're done and they're not coming back. And the level of reaction is usually dependent on the importance of creating separation for the person who splits. So the bigger their need to distance themselves from the therapist, the bigger the reaction they'll have. So people with a splitting defense often do really well in therapy if they can remain in therapy and work to challenge and understand the purpose of their splitting process. But sadly for many, the splitting often makes it impossible for them to continue the work, as they might feel so enraged by the therapist that they can never go back, or they could be filled with so much shame as a result of their angry outburst and totally full of projections that the therapist wouldn't want them back anyway. So in either case, they will have separated. They've sabotaged the intimacy, and at some level that keeps them feel safer, even though they've rejected themselves in the work. So people who split might circle down to seeing the therapist as good again once the intimacy's been sabotaged. And if they can share their experience with the therapist of this, then this might be helpful when the therapist is sick or has a holiday or is perceived to let them down again in the future and the splitting process activates again. It might just give them that awareness to be able to catch themselves when they're doing that. But that's a process that does take time and practice. So people with CPTSD, they're going to be projecting a lot in therapy because they're just in a constant state of hypervigilance. And they might even perceive the therapist as being a danger to them. And their reaction to that transference could even be dangerous for the therapist. To help people with CPTSD, we need to focus big style on raising their awareness of projection and transference so they can better understand how their CPTSD has them responding to the world. Because without awareness to the CPTSD, there is just reaction. And although their brain believes that their reaction is relevant because it's a survival measure, it may be inappropriate or even dangerous for them or others. So to grow the ability to challenge projection is paramount to understanding and managing CPTSD. And if our parents had narcissistic traits or were people who were very shaming and judgmental, or they just put a lot of pressure on us as children, then we're likely to project and feel that the therapist is judging us in some way, or that they've expectations of us that are beyond our capacity to meet. Or it might be that we lose our self-esteem and feel very weak and vulnerable around the therapist, or not clever enough for them. And because our sense of identity will have developed around how someone else wanted us to act and feel, then we might also feel anxious about saying anything that we believe the therapist won't agree with. So projection and transference are probably the most useful things to get your head around in and outside of therapy, because both of these processes are going to have you reacting to situations in ways that might not be appropriate or healthy for you or others. But we do need to be mindful that projection and transference are defensive strategies that were built on events that actually occurred in history, which means that we don't want to be ignoring them completely. No, not at all. They're there to protect you. We just want to be optimizing our process so we can access a bit more of our logical brain, so we can be a bit more analytical of situations rather than just reacting to them impulsively, because that's what projection and transference is telling us to do. And like I said earlier, the more trauma we've had in our past, then the harder this is going to be, because our brain has just got more bad things to look out for. So projection and transference are going to be a major reason why we might start feeling uncomfortable, icky, unsafe, unheard, or angry or abandoned around our therapist, and a host of other reactions. But these major factors aside, there are bound to be therapists in the world that are just not suitable for you. And this could be because they work in a way that's just not the best way for your learning style. It could also be that they're carrying a lot of their own issues, which they've not dealt with, that you might pick up on, or that they lack the capacity to form intimate relationships themselves, because if they can't do this, then how are they going to form one with you? So their process might sabotage the intimacy in the relationship and create some sort of transference. It could also be that they've just not got enough experience or knowledge of the areas that you want to work on, as that might mean, and if they aren't experienced in that area, it might mean that they miss you in some way, which might trigger you to become doubtful of them, and that could invite transference again. Or it could be that the therapist has a narcissistic process or some sort of personality style that needs to control the work, or they need to get some sort of recompense from the client so they feel okay after the session. So in effect, they're doing the work to meet their needs rather than the needs of the client. So we need to be able to give ourselves time to work to recognize if the way that we're responding to the therapist is appropriate to the situation, or if we're just projecting or getting caught up in some sort of transference. And this is going to take time, but if you're being reflective, then you're spending time in the logical centers of your brain, and you're likely to feel better for that too. It's sometimes hard for clients to do, but it's a really useful thing if you can share your projections or what you're experiencing in the transference with the therapist, especially if you think they're getting something wrong or missing you in some way, because you're the customer in therapy, and it's the therapist's job to hear your view and be self-reflective enough to check out if it's the client's projections that are causing the issue or something coming from their own process. And therapists have regular supervision specifically to deal with these types of issues. Well, hopefully that was useful for you. And if there are any other aspects of counselling or psychotherapy that you'd be interested in learning a little bit more about, just drop me a line in the comments and I'll see if I can do you a video. Well, thanks for watching, and goodbye.